So I came up with my list of 8 pearls of wisdom that I thought I would share with you. And it's actually an idea stimulated by my father, who in his residency training in the military always had a little notebook in his pocket where he wrote down all the pearls of wisdom that he learned from his patients during the day. So I have 8 of them for you today that I thought I would share. And the first of them is to find a mentor or mentors in your life that help guide you on the journey. And this first image is to tell you about, well, actually this is my second mentor. My father is my first, but this image of the heart and the brain coming together reminds me of one of my mentors, Earl Bakken, who is the inventor of the pacemaker and founded a little company called Medtronic. And I met him 20 years ago in the last month and the last week of my residency in medicine. And I went home exhausted and read a paper that he wrote 50 years ago called How to Design the Most Healing Hospital in America and Transform the Patient Experience. So I picked up the phone and called him, and I said, I'm just beginning my training. Can I come work in this hospital? And he started to laugh and he said, it's only a dream. And long story short, that hospital is open, is operating on the island of Hawaii, where he went to retire. And we've been on a journey for about 20 years to try to design a patient-centered model of care across the nation, which was not very popular for about the last 15 years of my life. So it's often a lonely journey, which is what I love about Rock Health, that you have a community here of people that support your ideas. But he came and met me in San Francisco a few years ago. He's 88. And he said, Bridget, what are we going to do next to fix healthcare? It's still so broken. And he said, why don't we start to connect the parts of the body and put it back together? We treat human beings as fragmented and diseased body parts. And he said, let's start with the heart and the brain. So he actually launched an institute called the Heart Brain Institute that was at the Cleveland Clinic, headed up by Dr. Mark Penn, and really created a field of medicine that studied the interconnections between the heart and the brain. And you've probably heard of things like broken heart syndrome, why when women feel something in their head, they have a manifestation in their heart. So number one is to really find mentors in your life that guide you on your journey and actually are in the foxhole with you and have your back, because often it's lonely when you're alone thinking of these ideas and you think you must be crazy. And this is a man who always sort of leans into the wind when everyone else thinks he's out on a limb. And then second, the most important thing is to focus on what really matters from the patient or the customer's perspective. And I think this is really about listening to them closely. And so Leslie asked me to share one of the design innovations that I have been involved in, and that was to redesign this horrific patient gown that everyone in the nation is subjected to if you come into healthcare. So I was actually asked to go meet with Diane von Furstenberg in New York to try to get her to help us redesign the patient gown. So I flew in there with one of the nurses I was working with. We went upstairs to her office above her store in an amazing part of New York. We sat there and we waited for about 20 minutes till she came in. She came in with her entourage, sat down at the table, and she said, oh, why are you here? Every hospital in New York has asked me to redesign the patient gown. I have absolutely no interest in this. And I said, why? Why not? She said, well, hospitals, I hate them. They're dirty, they smell, they're not clean, they're not friendly, there's nothing good about a hospital. And I said, well, that's why I'm asking for your help. I said, I want your help. I said, I pulled out the gown. I said, the first thing we do when you walk through the door is we strip you of your dignity. I said, I want you to help me restore dignity and respect back to the experience in healthcare and restore humanity to healthcare. And she looks at me and she goes, now this I have interest in. She said, you want me to help do this for across the nation, restore dignity and respect to healthcare through the design of the gown? And I said, yes. So she agreed to take on this project in a la her wrap dress and her gown. A prototype was launched, which is what this is, and she's helping to re-engineer and redesign a product in healthcare that helps rehumanize the experience. So it was one of those the pearl was really listen to what matters to patients, and when you talk to them, we just do so many things because we've always done them that way in healthcare, and we don't seem to think differently. And you go and you look at these antiquated things we do to people and think, why couldn't we do this different? The second is really listen to the voice of the customer. And when you listen, the pearls of wisdom come from their mouths on where we should innovate in healthcare today. One of the things we do the second you walk through the door or up to the emergency room is the first question they ask you is, Do you have insurance? Here's your copay. And now we're asked to ask, do you have a living will? So every patient on admission in healthcare today is now asked if they have a living will. So I brought my father in at 5:30 in the morning for his prostate surgery cancer, and the first thing she said to him was, do you have a living will? And my father looks at me and says, do I need one? Is something going to happen to me today? So it's, instead of, her looking at us saying, what are you concerned about today? This was the question. So when you listen to patients, what they really want is informed hope. So right before we put people to sleep, we have this informed consent form. We tell you everything that can go wrong. You can get an infection, bleed, and even die. Please sign here. Now we're going to put you to sleep. It's crazy. We do it because we've always done it. But when you stop and listen to patients, they'll say, I wish you'd just given me hope before you put me to sleep. So several hospitals have adopted the concept of we have to do the informed consent for legal reasons. But what about creation of a tool on paper or on an iPhone that lists all the things that can go well, so that with positive intention they can go to sleep knowing things will be fine and wake up on the other end, not going to sleep having just signed I can bleed, have an infection, and even die is the last thought in their mind. So walk in their shoes. The first thing I did when I was appointed the Chief Experience Officer at the Cleveland Clinic was put on my scrubs, and for 3 months I just walked in the shoes of the housekeepers, the valet service, the nurses, the doctors, and I came back in to the management and I said, I cannot focus on optimizing the patient experience until you first focus on optimizing the employee and the staff experience. And when you do that, you find amazing things that you can do to take off people's plates, and ways that you can use technology that put nurses back at the bedside or simplify what they do. There's amazing things where you can, a nurse can check in the ears or take vital signs and have that immediately recorded back into the chart versus them having to carry pieces of paper around. When you walk in their shoes, all of a sudden you see all kinds of opportunity where technology and process improvement can radically ease the burden of their job of what it takes to be a nurse. And so one CEO at a hospital that we're working with is amazing, Susan Ehrlich, and she walked in the shoes, and we said, just don't walk through with your suit on in the middle of a shift. Go in at night, go in the middle of the morning. She put on her scrubs, and she spent time on the night shift and the day shift and learned and saw amazing things in her organization, of things she could take off their plate and in ways that they could innovate. And it was on this journey that she actually learned from one of the pharmacists she was walking in the trenches, that one of the pharmacists, for 14 years he'd been doing this and nobody knew, that he could tell when he received an order for a drug for the first dose of chemo for breast cancer. He realized that this woman must have just been told she had breast cancer. So there was a way that he could see it in his computer. It was the first time she'd had this chemo ordered. So instead of just filling it, putting it in the bag, shoving it out the window, he would take the drug, get up, walk out into the lobby, and sit down next to her and say, I know this must be difficult. I wanted to sit here and walk you through this medication and answer any questions that you might have. So there's ways through technology that we could trigger alerts for staff and trigger and change the process of the way we've just done things in dispensing a medication that would provide great peace of mind for patients and for families. And then I think one of the most important things in designing around the patient is to map the gaps in the human experience of care. And that means is that we often in healthcare look at technologies that will make everybody more efficient and save money. We don't often look at what we could put back in that would restore a human connection or would provide peace of mind to patients and families. And as one organization said, we spend all this money on engineers stripping out waste and focusing on efficiency, which is important. So the technologies or ideas that you have that make things go better or easier are all really good. But we don't spend a lot of time listening to patients, walking in their shoes, and figuring out what's missing from the human experience of care and finding the always events versus the never events that you can put back in. And that's what we believe creates a healing experience and what creates loyalty and differentiation for those organizations in healthcare today. So from that process, one organization, they didn't join us here tonight, but they're here at our office, an amazing group of physicians at a small hospital in rural Missouri walked in the shoes of their staff and their patients, and they said, the most broken thing in our organization on this one floor that had the worst satisfaction scores was the admission process into the room, the intake of the patient. They came up from the emergency room and they were just put in the room. And they two physicians came up with the concept of what if we created a sacred moment on admission. And this team met in our X Lab where we designed, which Liz and Steve and Christine head up. We had this group together, and with the voice of patients, we said, what is it that they need and want on admission that would honor the sacred moment of what it is to have a relationship between a doc and a nurse and a patient, and a doc and a patient. And so we came up with a list of things. Instead of saying, what meds are you on, checking their vital signs, we asked them, what is your greatest fear or concern? What is it that we could address? What do you need to tap in to help you heal, address any spiritual needs that they might have, or other resources we could bring to bear? We asked them for what dietary needs did they have? When did they take their meds? Could we keep them on their own schedule? Did they like the room hot or cold? Did they have a family member that they wanted to serve as their personal navigator? How could we reach the family member? Could we text? Could we tweet? How did they want us to help them navigate the experience while they were in? And so they launched this concept of a sacred moment in one little unit on the floor, and now they're going to take that and roll that out throughout the rest of the hospital. But they're now thinking of ways, how could you use technology to create a sacred moment, or embed these sorts of questions in advance before a patient even arrived to the facility. You talked about helping with access or navigation with cancer. How could we find out some of these things and understand their expectations or their desires before they got to our hospital or our clinic, and create this sacred moment upon admission. We're also looking at how do you create a sacred moment upon discharge, and what technology could we use to allow that to occur. One patient said to us at a hospital, he said, I left the hospital on Friday, my surgery was scheduled on Monday on my heart, and he said, my greatest fear was not the impending surgery, but whether my heart would make it through the weekend. And he said, I was riddled with fear the entire weekend that I wouldn't make it. And I thought about that, and I thought, we sure failed him. We could have given him some sort of a lifeline or something through technology that he could have touched somebody and had a human being with whom he could connect just to get peace of mind over the weekend, that he knew he had somebody to reach out to, a lifeline, so that we could have taken away the stress of that moment. So we help organizations systematically map the gaps from the continuum of care, from the time they're diagnosed to the time they get to the hospital till after they leave, and find innovations that we can put back in by way of technology or others to put back in to the healthcare system. So one of my other pearls is take leaps of faith. Have the courage to go out on a limb and know that you're not crazy. This is people, when I started working with Earl Bakken, the CEO of Medtronic, said, Bridget, you can do whatever you want, but stay away from Earl and his foo-foo ideas and his foo-foo medicine. But he took leaps of faith and courage and was 20 years ahead of everybody else when everyone thought he was crazy. So don't be afraid to take risks and to take leaps of faith when you know in your gut, and trust your intuition of things that you know are missing or are broken in healthcare today, and go for it. And one of those is something called Code Lavender. You all know what a Code Blue is, where you would resuscitate the heart and the brain and the lungs. And Earl said to me about 15 years ago, we had launched this concept. He said to me, Bridget, do you think you will ever be able to launch Code Lavenders at places like the Cleveland Clinic or the Mayo Clinic or Camp Lejeune with the military? And I looked at him and I said, no way. They already think I'm crazy enough. I have enough arrows in my backside. And so a Code Lavender that we launched at his hospital went like this. The Code Lavender would go out on a people's pager. It'd say Code Lavender room 309. And everybody in the hospital would stop and send healing intention or prayer to room 309. And so he said to me, you think you could do this at other places? And I thought, oh, no way. So take a leap of faith and courage. And I know they're looking at me, these surgeons are looking at me like she's into this foo-foo medicine. And I saw Earl recently. I said, Earl, over 5,000 Code Lavenders have been launched at places like that. And they've changed a little bit. Now they go out, and they're also for the staff because of one enlightened charge nurse. She said, Bridget, on the pediatric ICU, we just took 2 kids off life support. They'd been here for 3 weeks. Everybody was so connected to these kids and the family. The doctors and the nurses are a mess. Can we call a Code Lavender for the staff? So I said, sure. So the Code Lavender team was deployed under the name of a healing services team. So it was pastoral care, integrative medicine, bioethics, the wellness team, and they brought all the resources to the floor to help address the emotional, spiritual well-being of the caregivers. And now we're looking at innovating through our Vocera parent company. Could we send out code Lavender or pages through our badges and other technologies to more rapidly resuscitate the emotional needs at people at critical points on their journey versus just resuscitating a diseased or a broken body part? So this is the way innovation comes from, really listening to the heart and the soul of what patients and families need, and then having the courage that even though people will say to you, this is crazy, and I remember trying to launch this day one at the Cleveland Clinic, and one neurosurgeon looked at me and he said, Dr. Duffy, we don't use words here like healing and optimal employee experience. We are a data-driven, results-oriented organization. And I looked at him and I said, I know you don't use those words yet. That's why I'm here. So it takes a lot of courage, and you have to have people on your flank and in the foxhole that cover you, because it's risky business trying to take on innovation. So you have to protect the Mavericks, because the people will try to take you out, because you are pioneers, you're on the cutting edge of innovating. So find people that have your flank and have your back. And I remember last year there was an event hosted called Women Who Think Big. My husband fondly called it the Badass Broads. But there were 40 women that came together, and when we made the introductions, they said, tell your name, what's the big idea you're working on to try to transform your industry, and name one woman that had your back during your career. And the saddest part for me was not one woman could name a woman that had their back during their career. About a third of us could name our mothers who said, go for it. But you have to find people that have your back, and then your job as innovators is to protect the next generation of innovators that come up and be mentors and supporters to them as they do the work. And give them a place to design, which is what I think is so impressive about Rock Health, is to give them a place where they can come and innovate and be with others like them to do that work. And that's what we do around the people that are here today, is we create a space where they can come together and share their big ideas, that we can help incubate them, we can help test them, prototype them, and then try to roll them out at multiple places at the same time to see if they actually work. And then dare to be different. I think this is what will differentiate your product. This is what will differentiate an organization who's adopting your product, and have the courage to do that. And that's why I brought some of the people in the room here. They all dare to be different and stand out, and I thought that they would be helpful to sort of share in the question and answer. And in closing, Earl really believes in dreaming on, and he has a list of I don't know how many hundreds of his dreams that now he's 88, looked back on his life and saw all of these that manifested and turned into some technology or some innovation that he's done. And this quote I absolutely love that Liz got from me by Alexander Blass, that true innovation improves the human experience. So if you keep that in mind and you trust your gut and use your intuition, you will come up with technologies that improve the human experience and really make a difference in the lives of the people that you serve.